Hey everybody, Dennis Stanley here with Lindsay Jones and Respiratory Sensei, the new YouTube channel that's dedicated to all things respiratory and maybe a few things Japanese. But did you know that there are millions of Americans who have asthma and that most of those Americans, their asthma is untreated or not treated properly and their asthma is not under control? And that's because of a little secret that I'm about to share with you that's right here on this card. So as the Japanese would say, Manabi Masho. Hiya! Yeah, so it's true that most Americans are not having their asthma treated properly. I want to share you a little bit of secret, and it has to do with the information on this card here. Now, this card is part of the Certified Asthma Educator program offered by Lindsay Jones, but you don't have to buy it to get this card. I'll put a link to a PDF so you can look at this card more closely. And let's take a tour. But first I want to just show you in brief how it works. Just by turning to this side of the card, you can ask the patient just a few basic questions. And what you're going to do is you're going to classify their asthma as either intermittent, mild persistent, moderate persistent, or severe persistent. Now, once you have a classification, then what you're going to do is you're going to turn the card around and it's going to show what step of treatment they should be on. Asthma is treated by what we call a stepwise approach. And if one step's not working, then we just go up a step. If their asthma is under control, then we go down a step or two. So let's take a closer peek at this card and the secret to treating asthma. Okay, here we are with that card again. Let's take a closer look. I want to talk about how this works. We're dealing with severity of asthma on one side of the card through a few basic questions that we can ask, and there's an interview involved. For the most part, there's some technical information here. We can mostly skip that, but I'll show you what we're talking about. And then based upon that, we can decide what the patient should be on. And so if we decide they're at one level, which we'll talk about by basic interview, we're going to decide whether they're intermittent, mild persistent, moderate persistent, etc. Then we're going to come over here and say, well, you should be on step 2 or 3 or 4 or 5, whatever that is. Now, that doesn't mean that that's perfect for the patient. You may have to start at that step and then may have to increase it. But what we find is that many people are not on the right step in the first place. So they usually are taking medications kind of haphazardly. Their family practice physician is probably experimenting with a little bit of corticosteroid, but they don't know what level of corticosteroid or what other drugs that they could be on to help control their asthma. Now, just to remind you all that you're looking at this, if you're a healthcare worker, a respiratory therapist, that's what I am, a nurse, you may be a physician assistant, you can certainly use the Lindsay Jones course to help you pass the Certified Asthma Educator exam, and this is just part of the course. But I also wanted those of you who have just family members who have asthma, or maybe you have asthma yourself, to be able to look at yourself and answer some of these questions here and decide, listen, I think I'm mild, and yet they have me on the intermittent treatment plan. So we'll talk about that, and that's the idea here. So let's take a closer look at this. Okay, so this is sometimes called the SALSA chart, and we'll talk about that later, but this is where we're going to classify the asthma. Now, there's some technical information here. It does have some age groupings here. For most of you, I'm assuming you're probably 12 years or older, and so we're going to look at that. But what we're looking at here is we ask questions like, how often are you having to take your short-acting bronchodilator? In other words, your inhaler. And if you're having to do it 2 or less days a week, then you're probably in the intermittent category. But we can ask a few more questions like, do you have any limitations in your activity? Do you not go outside? Do you not play? Those kinds of things. If you have no limitations, you're able to do kind of what you want to. And then, do you awake at night because of your asthma? Just those questions alone will help you to understand whether somebody is intermittent, mild, moderate, or severe. Now, there's some technical information on here for you physician offices if you're working. You could do a bedside pulmonary function test where we look at the forced X-ray volume. And this is just a little machine. It's easy to get. Some of you patients might even have one of these. I know you have a peak flow meter, and sometimes that electronic peak flow meter, if you're tracking your peak flows, can also tell you your FEV1. And so you would look that up. But what I want to say to most of you is that if I'm just sitting next to somebody on the train or the bus or wherever, I don't have to necessarily have a piece of equipment to test them on that part. I can just ask them the other questions like, well, how often do you take your inhaler? If they tell me, oh, less than 2 times a day, or less than 2 times a week, I should say, then I say, well, are your activities limited at all? No. And do you awake in the middle of the night? No. Then they're intermittent. Then I know that what they really need to be on is step 1, which we'll get to. But, as you increase that, some people may need their inhaler 3 to 6 times per week, meaning they don't need it every day, almost every day, at least half the days, almost every single day of the week, not quite every day. Then they're probably in the mild category, and they may be limited on a couple of things that they do, and maybe 1 time per month they'll say they awake and they have to take a breathing treatment in the middle of the night, and so that would be mild persistent. Then moderate persistent, that's when they have to use their short-acting bronchodilator every single day. Now maybe they use it once, maybe they use it twice, but if they're using it daily, that's a dead giveaway. They're in the moderate category. And then they may describe other things to you or not. They may describe their awakening or not. But I want to point out only one of these things has to be true for you to be in that category. And so even if you said, no, I'm not waking up at all and I can do anything I want to, that's probably a lie. They probably can't. But anyway, they're probably not jogging. They've probably already altered their life in such a way that they think that they're living their full life, but actually they're not doing some stuff they would like to be, like riding their bike. They've just given that up. But anyway, whatever. But if you still tell me that you're taking your short-acting bronchodilator, your inhaler daily, you need it every single day, then that's going to put you in the moderate category, even though that's the only one you said yes to. And then, of course, come down here to severe. Not only do you have to take your bronchodilator every day, but you have to take it multiple times a day or throughout the day. If somebody says, I don't even know how many times I have to take it a day, 4, 5, 6, I don't really keep track, then you're in the severe persistent category. All right, so let's take this, once we've classified them, just with a few basic questions, and we can flip the card over and we can understand what we're supposed to do with that. I just want to show you that SALSA, you don't have to know this, is somewhat nerdy. It's called a SALSA chart in case you see that out there. You could talk to your doctor about that. But, SALSA is the symptoms, the frequency of chest tightness, dyspnea, wheezing, and coughing. We don't necessarily ask about that because if somebody has an inhaler, if they have chest tightness, dyspnea, shortness of breath, or wheezing or coughing, they'll often take their inhaler. And so what I like to do is that S for symptoms, I just like to say that's SABA. How often do you have to use your short-acting bronchodilator? That's at least part of it. And that's also found in the other S down here. Anyway, then we also look at activity. Remember, we ask the patient, are you limited in your activity? A little bit, minor, moderate, severe. Lung function, we kind of skip that for most of us, unless you're a doctor's office and you have one of these little machines that you can check that out. But you can also look at your peak X-ray flow and then awakenings. What I want to point out here is what we really care about is how often are you using your inhaler, and how often do you awake during the night to take a treatment, and then are your activities being impacted? Just those questions will help you generally classify somebody as intermittent, mild persistent, or moderate persistent, or severe. And then, of course, what you do with that, you'll see here that you can turn the card over. If somebody's in the mild category, then you're going to come over to the mild persistent category of treatment. And there's 2 steps there. They need to be on at least step 3 or 4. If they're on step 3, it's not quite working, the doctor should advance them to 4. And so we have drugs there, and I won't go, this is not a pharmacology class, but should definitely be on some inhaled corticosteroids, and you might need some long-acting bronchodilators. That's a different drug classification. But if you're just on a corticosteroid, and you're on a short-acting bronchodilator, your inhaler, your albuterol inhaler, and you're still not feeling well, that it means that you probably need to be stepped up. So the doctor may need to add a long-acting bronchodilator, and they may even be able to add some other medications that are listed here that you can look at more closely. But that's how it really is supposed to work. Okay, so let's take a closer look at this one. These are the combinations of drugs. Now, this gets really nerdy. No one's going to memorize this unless you're taking the examination. but this is the card that you can use to show a doctor or look yourself and compare what medications you're on. So for instance, if you're in the severe persistent category, you should be on at least step 5, which meaning you should have a bronchodilator that you're taking from time to time. You should have a high-dose inhaled corticosteroid. Now, you might know you have your Combivent or your other inhaler that your doctor told you're supposed to rinse out your mouth after you take it, but you may not even know whether that's a high dose or a medium dose. So you might have to go to your doctor and say, yeah, but am I on a high dose? Because I'm still not feeling good. I'm still not feeling that control. And then, of course, you could also be on, and probably should be on, a long-acting bronchodilator. That's a third medication. And then there's some alternatives to that as well. Like you can be on montelukast, which also kind of suppresses I won't go into the nerdy part of it. It suppresses the immune system in a very specific way. And then, of course, if that's not helping, then that even needs to be stepped up with step 6, which is going to involve some oral steroids. So, the idea is that you just look and say, well, look, I'm supposed to be on step 5, but I'm only getting the medications really similar to step 3, and I'm not in control. And that's when you can go to your doctor and just talk about that and take a closer peek at that. Anyway, so this is just part of the asthma severity and classification program of the Certified Asthma Educator program offered by Lindsay Jones to prepare you for that credential. Well, I hope you enjoyed that. Isn't it amazing what this little card can do? So if you have asthma, you have a family member with asthma, or you treat patients with asthma, it's amazing how just with a few questions, you can classify them, and then with a little bit better understanding of what they should be on, you can increase their care to the point that they can control their asthma. And so if you enjoyed this video, I'd appreciate that virtual fist bump. Like this video. And then if you want to know more, please subscribe. And then, of course, if you have looked at yourself, your patient, your family member, yourself, and you've asked yourself some of these questions on that card, and you have found that you're not on the right treatment plan, make a comment. We'd love to hear about that. Millions of people have asthma, and so millions of people are interested in this exact topic. So we appreciate that. We'll see you next time. Ganbarimashou.